McCarthy Insurance Group, serving the community for over 70 years. For home, farm, motor, life, health and business insurance, log on to mig.ie or free phone 1800 50 11 11. Probably your best call in 2024. Charles McCarthy Insurance is trading as McCarthy Insurance Group, is regulated by the Central Bank of Ireland.
Ireland's Classic Hits Radio. I'm delighted to welcome back Dr.Sarah-Anne Bennett today on the show. You're very welcome.
Thank you, Trina. Glad to be back on.
Webdoctor are giving advice on when is a good time to visit your GP about menopausal symptoms. And I don't know what I seem to be hearing more and more stories about younger women having symptoms of perimenopause. So you might talk us through them today and what we can expect and when you really need to maybe speak to your GP.
I think, Trina, in response to younger women experiencing menopause, I think we're just more informed. But like in general, when you look at menopause, the average age that someone would hit menopause, in Ireland anyway, is about 51.
Yeah.
So menopause is when you come to the end of your cycling. You're no longer having periods. And if you're over the age of 50, if you haven't had a period for 12 months, that's menopause. Or if you're under the age of 50, you haven't had a period for 2 years, that's considered menopause. But the time before that is often when women are actually in that limbo era and they're going through what we call perimenopause, that transitional phase.
So if you're somebody who has a kind of irregular cycle anyway, I guess that can be hard to know when it's all kicking off for you.
Yeah, diagnosing menopause is actually done on a clinical basis, meaning that we diagnose menopause based on a combination of your symptoms and maybe if your periods are changing. So, for example, women start transitioning into perimenopause in their 40s. And some women will have periods that are regular and some will have periods that are irregular. And that may be combined with other symptoms. So there's such a vast array of symptoms that a woman can have when they're going through this transition period. It can muddy the waters and sometimes the symptoms are related to other things. So a thorough history, chat, physical examination if necessary is often part of a combination approach in how we diagnose if somebody's gone into perimenopause or postmenopause.
I think actually we mentioned before, Sarah, about sometimes people may think they're starting menopause and they could actually be pregnant. So you need to watch out for that as well.
That's the thing, we would advise women that, up until the age of 55, unless you have proven that you're postmenopausal, to be on some form of contraception. So whilst your ovaries are winding down, you can still be ovulating. Yeah. So pregnancy, of course, is one of the main causes of absence of periods and should always be screened for.
I say you've delivered that news to some people over the years, have you?
I have seen a few menopause babies. I have.
Okay, so you mentioned there about the symptoms. What would be the main symptoms that you would realise apart from the period? I mean, we hear a little bit about the hot flushes and all that, but that's not a symptom for everybody.
100%. There's such a large array of symptoms that somebody can suffer from. I liken menopause to like a surprise package that you didn't exactly order, but it comes with a variety of unexpected gifts. So some common gifts that women notice may or may not include the periods. So they might have increased frequency of the periods, or they might have irregularity of their periods. They might become lighter or heavier. And then outside of that, you have your classic common symptoms, which are hot flushes, night sweats. That can disrupt a woman's sleep. They could have insomnia as a result of it as well. Then you move on to other areas. They can have the classic brain fog, low mood, anxiety. It can interfere with a person's cardiovascular system. They may experience heart palpitations, fluttering. Some women report having recurring UTIs. And then you're getting into metabolic issues around weight gain, loss of muscle. You're hearing people talk about aches and pains in the joints. So it's a real mixed bag of symptoms.
Yeah.
And
it's great,
8 in 10 women have symptoms for a time before and after their period stops. So the periods aren't necessarily the only way that we can judge it. And symptoms can start even 7 years before your periods are stopped. So it's important to note that not every person will experience the same. And the impact on somebody's quality of life can vary greatly as well.
And you know what the thing is? Now that we're all talking about menopause, we're all starting to realise the penny is dropping now. When our mothers were going through it, we're like, that explains that behaviour, or that explains why she might have been a bit cranky with us at times, or forgetful, or, you know. And there are women who feel like they're getting Alzheimer's or something because they're having the brain fog. But it's all to do with this.
I think it's probably one of the most rewarding consultations I have when I put somebody on treatment and we think this is all related to perimenopause and menopause, and they come back within 3 months and they're like, I feel like myself again.
Yeah.
And I often have women coming to me and saying, I just don't feel like myself. I don't behave like myself anymore. My body feels like it's falling apart. And then you put them on treatment and there's this return of the sense of self. And I think it's a really rewarding thing to see as a doctor, to see people improve so quickly, because the treatment can be very effective.
Okay, so what treatments are available then?
Okay, but the gold standard that everybody would know about is HRT, where you hormonally replace the levels of estrogen in the body, because most of the symptoms are caused by a declining level of estrogen, particularly hot flashes, night sweats and vaginal dryness. They can all be treated with estrogen. So we have different types of HRT that a woman can use, and it's important to talk this over with your GP or with ourselves online. We have a menopausal clinic as well at Webdoctor. Women who have a uterus versus women who don't have a uterus are treated differently. That's the first thing I would say. Not everybody can take estrogen on its own. If you have a uterus, you need to go on a form of progesterone with that, because there are certain risk factors. So HRT is really helpful. And when I put women on this, and this is treating kind of these classic symptoms, usually within 4 weeks, women will notice a difference or an improvement. Now, we may need to go up and down in doses. That really depends. There's different ways you can take the HRT. There's patches, there's creams, there's gels, there's sprays. And so you might choose something based on risk assessing a woman and what would be most suitable, and also what their preference might be and their overall medical history. Not forgetting, and always including, lifestyle interventions. And I think this gets overlooked a little bit, but it's so important that a woman is eating a really, really well-balanced diet. It's so important that a woman, as they go through into menopause, that they're exercising. So we know that women, as we age, as we lose estrogen, we're at higher risk of mood changes, we're at higher risk of cirrhosis, cardiovascular disease. So it's really important that you're not just treating one particular symptom, that you're trying to prevent stuff as well. And HRT combined with lifestyle interventions, to me, would be the gold standard intervention that you would give someone. Okay.
Are there some women who will be referred to a hospital? Because I know there's a lot of the maternity hospitals would have, menopause clinics and that as well.
Yeah. And classically, we would deal with the typical classic menopausal woman who doesn't have any major risk factors. Some women need to go to specialist hubs. So, for example, if a woman had a history of breast cancer, if a woman has some other kind of cardiovascular complication, where you're trying to weigh up the risk-benefit around the interventions, it's probably best to refer that patient onto a specialised menopause hub. And there are a few of them dotted around the country, which you can find on the HSE websites.
Okay, brilliant. All right, well, lovely to talk as always. Dr. Sarah-Anne Bennett there, talking all things menopause, and she's with Webdoctor. It's Ireland's Classic Hits Radio.